So today I'm here with Pamela. I believe her story is quite inspiring because of her conditions prior of coming in for treatment. She was diagnosed with stage 4 breast cancer, and prior of coming in she was experiencing a variety of symptoms that were interfering a lot with her quality of life. Her not being able to move her neck properly. The cancer at that point infiltrated the chest wall, the skin, and there was also severe lymphedema, which is very common in patients with breast cancer. So how are you doing today, Pamela?
Today I'm much better. Back, like you mentioned, in March of 2020, I was really bad. I didn't even know if I was going to make it. And here I am over a year later, and I'm still here. By the grace of God, I'm still here. And I'm so thankful to Immunity Therapy Center and your knowledge as well, Dr. Alvarez. I'm so glad that you were assigned to me and I was assigned to you. And our relationship has grown because of it, this whole time, because I've responded so well to the treatments that you've recommended.
Yes. Well, I remember that at the beginning, we all believed it was challenging, the case, given the circumstances at that point. But also combining several methods, working on your nutrition, working on your immune system's ability to recognize cancer, creating certain environments on your body, your nutrition, stimulating detoxification, it helped. We believe that combining several things, several treatments, definitely makes an impact on the patient's condition. It's important to understand that the treatment, while patients are doing their therapies in here, that's an important part, obviously, but also the follow-up and the changes on your lifestyle in managing your stress, your anxiety, nutrition, it all plays an important role as well. So can you tell us a little more about how things have changed for you over the past year?
Well, here, doing the treatments, get up every day and, last year when I was in the hospital, it was 7 days a week. They did treatments for me in my hospital bed. And when I was an outpatient, that's when I would get up in the morning and then go and get my treatments every day. And there's a lot to cover in what Immunity Therapy Center does per patient. Yes, you personalize it, but also there's common ones that mostly everybody receives. But once you're done, with the program, it's kind of like you go home and you continue to eat right, exercise, do some therapies at home and supplements. So you don't just stop when you leave here. You continue and you come back for follow-up, and and you just continue with the treatments. And if they feel that you need to change it, because cancer is smart,
yes.
It could adapt. You've changed it in a way so I don't become resistant to the therapies. So it's been successful, and I've been, feeling very good about it.
I'm glad you've been responding well. What makes the difference is, like I said, customizing a program according to the patient's needs. Reviewing blood work, see metabolically how the patient is doing, reviewing a complete blood count, checking cancer markers, checking even immunohistochemistry studies, studies related with the diagnosis itself. Do you consider the treatments to be invasive?
Not necessarily. I feel like they're not hard treatments to endure. I think just the overall going through them day in, day out can tire you, but that's about it. Nothing's painful. Well, maybe a shot, but other than that, nothing's really painful or invasive, I would say.
And during your treatment period, while you're doing your therapies, getting your IVs, doing, for example, the hyperthermia treatment, are you relaxed? Are you comfortable while you're doing that, the treatments?
Pretty much. I know that sometimes some people that I've noticed, their blood pressure can maintain a higher blood pressure, where mine tend to, after 20-25 minutes, go down. And I'm so thankful that a nurse is there always watching me and checking on me every 15 minutes or 5 minutes if need be, to make sure that I'm okay. If I start feeling lethargic or sleepy, that's when they'll check on me. And so I feel really safe and protected. I feel like, I could put my trust, in the nurse that's watching over me on
And what do you think overall of Dr. Bautista's protocol?
I'm so thankful for Dr. Bautista because he understands, because he's had his father, pass away from the conventional route of cancer treatment. So he has a more gentle approach, and, he doesn't want to see the patients suffer. I really believe that he cares, and that's why I'm here. I love the fact that he is here all the time. I feel like he cares about my circumstance, my condition. And I know he carries a lot on his shoulders because he cares for every individual that is here. So I admire him, and what he does, and I'm grateful for what he does.
And how do you like the environment here with the nurses, the doctors? I mean, how do you feel in that aspect?
Well, I got a good doctor. Doctors, nurses, kitchen staff, even the housekeeping, Rosie and pharmacy. Everybody here is like family. Everybody here is so kind to each, not just me, each patient, their caregivers as well. Anybody that's here feels like they're welcomed here. And I love the building. It's clean. It's decorative. It's so modern, and it's beautiful here.
Okay. It's in your situation. I mean, we've been evaluating your progress based on 3 factors, and that's normally how we do it with other patients, not necessarily with the same diagnosis as yours. But for example, we have cancer markers that we can take every 10 days, every 15 days, which would be helpful. Will let us know or give us an idea on how active the cancer is and how it's responding to the treatment. Also clinically, which I believe is very important, what we're noticing, the symptoms getting better, the pain being better. In your case, the fact that you're basically moving your neck as normal, the lymphedema has come down drastically. I mean, and even the lesion itself, it has improved as well as the skin. And well, also it's important, imaging studies. There are different options there, but it's important for us that our patients know that if they need a little longer, in terms of more treatment, it should be, evidence that things are going according to plan. And in your case, it has been like that. So what do you think of the way that we evaluate response to treatments? Do you feel comfortable when you decide to stay a little longer?
Yes, especially clinically. I've noticed that I was more willing to stay when I started seeing outward results. We can't really notice what's going on the inside as much as we can see on the outside what's going on.
Yes.
Markers, blood markers as well. When you start seeing them going down, it's encouraging. So you want to stay because you know something good is happening. As far as the scans, those that could wait for me. You know, I'm sure for somebody else it might be very important. They want to scan, they want to see what's on the inside now. For me, I've had scans in the past, so it's not necessary for me. I could wait on that. But I think it's a great approach.
Okay. And regarding the nutritional aspect of the treatment, do you consider the nutrition to be good for you? Have you adapted properly to the nutrition? Is the nutritionist, talking to you often? What do you think of nutrition?
The nutrition is very important to me. I've been eating clean. What I mean by like no meats, dairy, no dairy. I'll have a little bit of fish, but barely, because I don't really care for it. But lots of vegetables, fruits that are low glycemic. Those are important to me. I've been eating like that even prior to coming to Immunity Therapy Center. Because I believe in the fact that glucose or sugar will feed the cancer. So I stay away from it. Do I have a little cheat? Maybe, a little once in a big great while, because I'm not, that's not like, I know what it can do to the body. It's in my mind more than anything. So if I feel like, oh no, I should stay away from that, I'll stay away from food. But there's certain foods that I want to promote, and that's like certain things that will address cancer, that will kill cancer.
Yes.
So it's important to me. Nutrition is very important to me.
Yeah. As I mentioned to you over the past, I think that when we met, I definitely believe that there's a relation between cancer and emotions. 9 out of 10 patients prior of their diagnosis, they would experience anxiety, depression, stress, and it's something that we want to manage as well, or help. Emotionally, how you're feeling right now compared to how you were doing when you first came in for treatment?
It was a battle, emotionally. It's really hard to be happy when you don't feel good.
Of course.
The better I feel, the happier I am. So emotionally, I have to, talk to myself, talk to my mind. But I do a lot of praying. I do a lot of reading of scripture. I try to, boost myself spiritually more than emotionally. Because if I'm spiritually minded, I'll be happier. Because I feel that God is watching over me. He's protecting me. So I feel safe. Where if I'm lost, without Him, then of course I have nothing to turn to for my emotionally, satisfaction.
Well, I personally believe that every good result that we get, or everything that we're doing here, it's at least in my case, it's guided by Him. So, it's a huge, important factor.
Yes, it is.
And overall, what do you think your response has been, until this moment? How do you feel right now?
I'm here. I'm alive. I'm here today. I believe because of Immunity Therapy Center. Yeah, and God has used Immunity Therapy Center to make me be here today. Because honestly, last year I didn't think I was going to make it. After 2 weeks, I thought, I'm not going to be here no more. But here I am, over a year later. I'm still here, and I'm still going. And I will fight for life. Be in this fight until I take my last breath.
Well, we're seeing improvement, daily. It's, what type of improvement we're seeing. It's huge difference on how your chest looks right now. Like I mentioned, the lymphedema, less pain, the movement. So you're totally a different, patient than when you first arrived.
Oh, yeah.
So, we're expecting to keep seeing good results, and we're really happy, to have you here.
Thank you. I appreciate that. Thank you.
It's a pleasure. Well, thank you for watching our video. We'll be posting more information about our treatments. If you want to learn a little more about our therapies, you can go to immunitytherapycenter.com. Thank you. Have a good day.